Your teenage child has been diagnosed with functional neurological disorder, short for FND. Does your child or you as a parent know what triggers your child's FND symptoms? Let's get to it. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and chronic pain survivor myself. My mission is to help teens and their parents resolve persistent physical symptoms such as chronic pain and FND so that they can get their life back and feel like normal again. Because I have been treating these teens who's been struggling with FND and chronic pain in my private practice and in online program, and they have been getting so much better and get their life back that they truly deserve. If you're new to this channel, welcome, and make sure to grab a free PDF parenting guide on how to help your teen at home who is struggling with chronic pain and FND. The link is down below. All right, so today's video is about your teenage child's FND triggers. So first of all, do we know the difference between the triggers and the warning signs? Let's start from there and then go one by one. So triggers essentially sort of like what happens exactly before or leading up to the symptoms, both internally and or externally. So it could be something like anything related to stress, right? It's not just about psychological, but it could be biological stress or social stress, right? Could be school, loud noise, too much commotions in the environment, fight with friends or families, or just thinking about tests and thinking about bad things, and thinking about how dizzy they are, and thinking about whatever. Anything that could be triggers, or it could be weather, it could be sudden changes in the temperature, it could be a light switch, and it could be just watching something that would remind them of something. So any of these things can be a trigger. So technically speaking, it's also called antecedent. So anything that happens before the behavior happens. The behavior in this case is FND symptoms. Now, warning signs, they sound kind of similar, but slightly different. So the warning signs are what your child is experiencing directly right before or during the symptoms. So examples can be something like feeling like off or weird internally, or there's a pain maybe, such as headaches and joint pain and then escalating pain, or they could also feel tingling or numbness in their body or limb or legs or somewhere else in the body. They might also feel weak or feeling panicky or feeling like passing out or nauseated. So these are the things that they would be feeling internally to tell, I am about to have an episode of FND. And it could be also cognitive. So for example, oh no, that kind of like a sense of threat or feelings of fear that your child might be experiencing right before it happens. So that could be part of the warning sign. The other warning sign might be thinking, here we go. I had this sensation before, so I know I am going to have an episode again. Something like that. So anything that your child is basically anticipating to have a symptom. So that could be part of a warning signs. And ideally, if your child knows what the triggers are and the warning signs are, great, because what they can do is to know what they are so then they can do something about it, either to prevent the situations from happening or be able to feel prepared to manage the symptoms so they can sort of ride off the symptoms. However, the majority of the teens, especially before they go into any treatment for their FND, it might be difficult for them to figure out what the triggers are or warning signs are. They might be experiencing something, but they might not be thinking about it because it takes a little bit of time for them to sit back and think before they recognize those are the signs. So one of the things you can do with your child, well, I would like your child to be taking the lead on this one as much as possible. However, you can also ask your child, is there anything you can think of that would trigger you? And if your child gets super emotional and says, I don't know, no need to push, just let them take a break. That's okay. If you don't know the triggers, I heard on this video that many teens actually don't know the triggers. So that's totally okay. Just let it go. You can also ask, so what could be the signs that you can tell that you're about to have an episode? So do you feel a little bit off, or there is a pain, maybe feeling numb or tingling or weakness, or feeling panicky, or feeling like a passing out, or feeling nauseous, or trying to seek for some help, or look around, or look disoriented, or any of these things can be a good for your child to know, so then they feel a little bit more prepared instead of feeling, oh, here we go, there's nothing I can do about it. So as I mentioned, functional neurological disorder is a dysfunction of the balance between the brain and the body. Therefore, the best treatment approach is for your child to learn skills to regulate the autonomic nervous system, neurocircuitry, brain-body balance, whatever you want to call it, that balance inside of their body and the brain. And in my program, I emphasize that there are two things that your teen absolutely needs to have in order to successfully overcome these symptoms, such as FND or chronic pain. They are, number one, self-empowerment. So they have to feel like they're in charge of their body and their mind. Therefore, you as a parent continue to hover and bombard with questions, and managing the symptoms for your child sort of does a disservice to your child, who is really needing to have this sense of self-agency. The second part is the self-awareness. Your child absolutely needs to have self-awareness. Therefore, asking these questions to bring the awareness onto the surface to think about these warning signs or triggers for your child might be one of the first steps. Now, if you and your bright teenage child are ready to take actionable solutions to resolve chronic pain or FND, you might be a good fit for my program. Click the link below to schedule a call to talk to me today and see if you qualify for the program. Thank you so much for watching this video, and I will see you in the next video.